Inderal XL is a medication that falls into the category of beta blockers, and it is commonly used to treat high blood pressure. By lowering high blood pressure, this medication can help prevent strokes, heart attacks, and kidney problems. It works by blocking the action of certain natural chemicals in your body, such as epinephrine, that affect the heart and blood vessels. This results in a lowering of heart rate, blood pressure, and strain on the heart. It is typically taken once a day, and the dosage may vary depending on your condition and response to the medication. It is best to take Inderal XL at the same time each day to maintain a consistent level in your body. Always follow the dosage instructions provided by your doctor or pharmacist. Be sure to take Inderal XL exactly as prescribed by your doctor, usually once daily at bedtime. Swallow the capsules whole and do not crush or chew them. You can take this medication with or without food, but it's important to choose one way and stick with it for each dose. The dosage will be determined based on your medical condition and response to treatment. It's important to take this medication regularly in order to get the most benefit from it. Try to take it at the same time each day to help you remember. Keep taking it even if you feel well, as most people with high blood pressure do not feel sick. It may take 1 to 2 weeks before you experience the full benefit of this drug. If you are also taking certain drugs to lower your cholesterol, be sure to take Inderal XL at least 1 hour before or at least 4 hours after these medications. Be sure to inform your doctor if your condition worsens, such as if your routine blood pressure readings increase. As your body gets used to Inderal XL, you may experience dizziness, lightheadedness, tiredness, nausea, vomiting, stomach pain, vision changes, trouble sleeping, and unusual dreams. If any of these effects persist or worsen, notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. This medication may reduce blood flow to your hands and feet, causing them to feel cold. Smoking may worsen this effect, so it's best to dress warmly and avoid tobacco use. It's important to remember that your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. However, be sure to inform your doctor promptly if you experience serious side effects such as blue fingers/toes, mental or mood changes, numbness or tingling of arms/legs, new or worsening symptoms of heart failure, very slow heartbeat, fainting, decreased sexual ability, increased thirst/urination, easy bruising/bleeding, signs of infection, or aching/swollen joints. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed here. It's also important to know how to reach out for medical advice about any side effects. In the U.S., call your doctor or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor or report side effects to Health Canada at 1-866-234-2345. It's important not to stop using Inderal XL without first talking to your doctor. Suddenly stopping the medication could make your condition worse, especially if you have chest pain or heart disease. If your doctor decides you should stop taking Inderal XL, they will give you instructions for gradually decreasing your dose. When you are gradually stopping this medication, it is recommended to limit physical activity to decrease strain on the heart. If you experience worsening chest pain, tightness in the chest pain spreading to the jaw/neck/arm, unusual sweating, trouble breathing, or fast/irregular heartbeat, seek medical help right away. It's important to follow your doctor's instructions closely to ensure your safety while taking Inderal XL. Before taking Inderal XL, let your doctor know if you are allergic to it or other beta blockers, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Tell your doctor your medical history, especially if you have breathing problems, heart conditions, thyroid issues, kidney or liver disease, blood circulation problems, tumors, mental/mood disorders, muscle/nerve disease, or severe allergic reactions. Inderal XL may cause dizziness. Avoid alcohol or marijuana, as they can increase this effect. Do not drive or use machinery until you can do so safely. Limit alcoholic beverages and talk to your doctor if you use marijuana. Before surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. This medication may prevent the fast or pounding heartbeat associated with low blood sugar levels. If you have diabetes, monitor your blood sugar levels regularly and contact your doctor if you experience symptoms of high blood sugar. Children may be at greater risk for low blood sugar while using this drug. Ensure they eat regularly and notify the doctor if they cannot eat, are vomiting, or have symptoms of low blood sugar. Use this medication during pregnancy only if clearly needed, and discuss the risks and benefits with your doctor. This drug passes into breast milk, so consult your doctor before breastfeeding. When taking Inderal XL, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription, non-prescription, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Inderal XL include alpha blockers, aluminum hydroxide, chlorpromazine, other drugs to treat high blood pressure, epinephrine, and other heart medications. It's important to discuss with your doctor or pharmacist if you are taking any of these medications. Additionally, other medications can affect the removal of propranolol from your body, which may affect how Inderal XL works. Examples include cimetidine, certain SSRI antidepressants, and rifamycins. It's also important to be cautious of products that could raise your heart rate or blood pressure, such as cough and cold products, diet aids, or NSAIDs. Be sure to talk to your pharmacist about how to use these products safely while taking Inderal XL. Finally, it's important to be aware that Inderal XL may interfere with certain lab tests, potentially causing false results. Make sure that lab personnel and all your doctors are aware that you are taking this medication. If you suspect an overdose or experience serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include unusually slow heartbeat, severe dizziness, slow or shallow breathing, weakness, or fainting. It's important not to share Inderal XL with others. In addition to taking the medication, making lifestyle changes such as participating in stress reduction programs, exercising, and adjusting your diet may help increase the effectiveness of the medicine. It's a good idea to talk to your doctor or pharmacist about what lifestyle changes might be beneficial for you. While taking Inderal XL, it's important to have your blood pressure and pulse checked regularly. Your doctor may recommend learning how to monitor your own blood pressure and pulse, so be sure to discuss this with them. If you forget to take a dose of Inderal XL, take it as soon as you remember, unless it is within 8 hours of your next scheduled dose. If it is within 8 hours of your next dose, then skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. Make sure to store Inderal XL at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When you no longer need the medication or it has expired, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.